Hello, dear Professor Lynne Lourdes Lucena. As the Neurotrauma Treatment Simulation Center reaches its third edition, we are glad you join us in the pursuit of improving multidisciplinary neurotrauma management. This annual event showcases our ongoing commitment to advancing the field of neurotrauma management through immersive learning experiences and collaboration, bringing together participants from various backgrounds and countries. We would like to ask you a few questions about your perspective on the NTSC and multidisciplinary neurotrauma management.
Sure.
So firstly, what is your role in your delegation, your background and focus in your practice, and how does your expertise impact your perspective on neurotrauma management?
First of all, good afternoon, good day, good morning to everyone. I am the founding president of the Neurotrauma Society of the Philippines. I presently am also the vice president of the Academy of Filipino Neurosurgeons, and I'm the chair of Neurotrauma Committee of the Asian Australasian Society of Neurological Surgeons. So with this, I'm a strong advocate for multidisciplinary management and holistic treatment and care for patients of neurotrauma, whether it's brain, spinal cord, or peripheral nerve trauma. So with around 32 years of attending neurotrauma patients, this has been my role ever since. And aside from attending to other cases, this has been my primary role because number one, it is needed. Neurotrauma is a burden, a public health burden. And number two, we can do something about it, especially since these patients are the young patients. So with that, we focus more on the perspective, what is my impact as an expert. I am not just focusing now on decreasing mortality from neurotrauma. I'm focusing more on the long-term goals, meaning to decrease morbidity, to increase the functionality of patients who are neurotrauma victims, and to increase their productivity so that they can again become members of the society in terms of productivity.
Right, so related to the point you've made, NTSC aims to change the treatment paradigm from short-term focus to long-term follow-up. What would be some country and institution-specific strengths and limitations in neurotrauma management?
Okay, first of all, limitations, country and institution-wise, number one is the pre-hospital care. We don't have a really good system of pre-hospital, meaning retrieving patients from the injury site. Usually the ones who are retrieving are the bystanders, okay, especially in the provinces. Number two, the ICU care has been improving a bit, okay, but we don't have that dedicated neurotrauma ICU yet. And number three, limitation is also the post-surgical or post-hospitalization care, meaning the rehab, the cognitive, in which patients could be affected in their cognition, their memory, or even behavior. We lack rehab med doctors, physical therapists, occupational therapists, speech therapists, and also we lack neuropsychiatrists.
All right, and what would be some strengths?
The strengths, though, is that once you find it, for example, in my institution, the medical director or the administration is very supportive. So meaning I can bring in the Neurotrauma Society of the Philippines to partner with my institution to start some programs, even also partnering with AMN and NTSC. That's my long-term goal, to bring the NTSC and AMN also there for more education in our institution. But not just in the institution, but also in the country, okay? There are also growing number of specialists, especially neurointensivists, especially in Manila. So ICU care is growing, and awareness of neurotrauma in terms of the specialists is also growing, maybe because we are creating awareness now. Okay, so but before there's none. But the receptivity of our colleagues is actually growing.
All right. What do you consider to be an effective multidisciplinary team when treating neurotrauma cases?
Okay, so effective team. So first of all, we should have emergency physicians and paramedics well trained at that. So these emergency physicians who will retrieve patients from the pre-injury site, in the injury site, should also translate to the emergency care medicine physician. And then you would have now at the hospital, at the institution, your neurosurgeon and then your trauma surgeon. There should be a trauma surgeon who would clear the patient or address the other problems in patients who have polytrauma. And then you have your neuroanesthesiologist and then neurointensivist or neurologist your neuroradiologist, your neuropsychiatrist, neurorehab, the nurses who should be trained in neurotrauma care, then PTs, OTs, internal med pediatricians. Okay, those other allied professions should also be there. There's a lot really in the team. A good team should have all these elements from pre-hospital to post-hospital care.
All right, and my last question would be, what lessons do you expect to learn from this program?
Okay, I think the NTSC is very much needed in as what it has been promoting, okay, education and training. So it is already advanced. So meaning it has almost reached the peak of neurotrauma care with its simulation and experience. So what will I learn? I intend to, of course, learn a lot and bring home the lessons that I can see which could be applicable in our country. So maybe step by step, and then I'll invite the experts from here so that we can have some infusion of knowledge into our country. And at the same time, we could ask, like share our experiences also, what are the gaps, so that they can actually bridge it. So it's more of collaboration for education and research later on, and to achieve more what we are going for, which is multidisciplinary treatment of neurotrauma.
Right. Thank you very much for the interview, Professor Lucena.